folks, Peter Paul here, Sykes Group. Back again for another video. Today, we're going to do a second video on urban city survival and preparedness. Today, we're going to have a good friend of mine, Mark Hicks, who's a trained EMT, and he's also a trainer for people in the EMT profession. He's also part of the search and rescue group, and he does many classes on first aid. He's going to show us how to put together a first aid kit, also known as an IFAK, and he's going to give us some helpful hints on what we need to do in case of an emergency. Stay tuned.
Hi, my name is Mark Hicks and this is John Wilson. We're both EMTs with the North Shore Rescue Squad on Staten Island. People have been asking us, well, what do you carry for first aid? How do you prepare yourself as someone who becomes suddenly sick or injured and you need to have the equipment available to you? There are a lot of things you can buy commercially, but a lot of these bags are very expensive and it has a lot of equipment, things that you would never use or you would never have any understanding of how to use them. So what we're going to do here is we're going to show you the kind of bags that we as EMTs you might see us using. We'll have these kinds of equipment that we will use for trauma and for medical emergencies. We'll show you what's in them, what kind of bags you might be able to get. And then we're going to introduce you to maybe how you build a bag for yourself, for your own personal use. So John's going to start with us. I'm going to first show you this bag here. This is one of the bags that we carry on our ambulance. You'll see the EMTs coming off with a big blue bag or maybe a big green bag. The green bag will have oxygen in it and some oxygen supplies. But our trauma bag will have inside of it the things that we will use for most kinds of trauma. We have gloves inside of here. We have large trauma pads for whatever we might find, someone who might be burned, someone who's got some kind of major trauma going on. We have all kinds of trauma pads for that. We've got large bandages and wraps. We've got gloves and other equipment that we will use for whatever kind of trauma that we come across. It's meant to be all-encompassing and able to use and mix and match for the different kinds of emergencies that might occur. So John, what do you have in this bag?
Okay, this bag right here is my personal bag that I use. Generally this bag I keep at home. If I'm going out on a trip, camping, hiking, out with the family on a vacation, or just driving along the road, I normally keep this in my trunk or in the back of my truck. The difference between these three bags and the bag Mark explained, if you notice the material here, this is more like a rubber type material if you're out in the rain and all that, because on the ambulances we're in and out all kinds of weather, so that'll sustain the weather. This is more cloth type. So this bag right here is my personal bag. It's a larger version of this bag right here. And these bags flap, they open from the top and you're looking down into them, right? So it has a pouch like this, pockets, different sections where you can section off your equipment. So I'm gonna remove this bag from the table. And just before I tell you what's in my bag, I'm going to show you a different type bag, which is this bag right here. These bags here you look down into. This type bag is more of an open flap where you see different pockets and net pockets like this where you can keep things. And just for an example, I threw ace bandages in just so that you can see different type things you can put in this bag. There's two meshes there. You can also keep equipment here, and you can has little loops here where you can also attach equipment to. That's just an example there. If you really don't want something to get wet or books of material, it has a little inside flap there as well. This is what you call a Black Hawk bag.
So this is a backpack style bag, John. Unlike the other bags where you have handles to carry them, you carry this bag on your back. Is that right?
Just like that. You can throw it on your backpack and you can hike with it as well. Exactly. So I'm gonna it has another flap there with more things where you can attach.
Lots of equipment. This is a truly trauma bag that a medic's going to carry. All kinds of equipment, handle major trauma out in the field.
Okay. So this bag right here, like I was saying, the first thing I'd like to point out is know what's in your bag, know your limitations like Mark always says.
Absolutely.
So don't put anything in your bag where you're going to be guessing your way around. Don't make it complicated. So I'm going to open it here, and unlike that bag that's rubber, if I get caught in the rain, I always like to throw a garbage bag in there to cover. First I put the garbage bag in, and then I'll put that pouch in, that segmentation I showed you.
So we'll start with a bag of bags then.
So we'll go here. This is what you call a chem light. So with the chem light, you snap that, and that'll last about 8 hours, just in case you're caught in the dark on the highway late at night and anything like that. You don't have a flashlight. Of course, I have a little magnifying glass there, in case I can't see. I use the loops to my advantage. I get little rings like this. You can buy these rings in pouches and packs. I throw the rings on the loops there, and now I can loop it. Here's a tourniquet right here, easy to slide in, a rubber one. Here's scissors here if I need to. They fold. There's all kinds of different types of scissors and shears out there that you can use. This is just a quick ready one. Now, should I carry any pills for myself, because I always look out for myself as well. If I can't help myself, then I can help someone else. If I have any medication for myself, I'll keep it in this little rubber sealed pouch right here.
And you want to be careful about actually carrying medications in your first aid kit that you're going to give to them. And you want to be careful about not giving your medication to someone else, because you never know what kind of allergies they may have, what kind of medications they may be taking, and when you give your medication to someone else, who knows what can happen. So you really want to be careful about giving your medications to anyone else.
And now, this is a little advanced, but if I have someone, if you take an administration of emergency oxygen course with us, someone who can't maintain an open airway on their own, these are what we call airways right here, oral airways, oropharyngeal airways, and I just loop them here at different sizes. The other thing is, if I'm out on the road or the highway, we always practice make sure the scene is safe for safety first, so I carry little vests here. If I have to throw on a safety vest, it's always good to have a safety vest with you.
Keep one of those in my car anyway.
Correct. And then I'll dig around my side here. If I have any hazmat, if I have to go into some trauma or anything, I don't want to leave my dressing around on the floor where kids or anybody can pick it up. So I have a little biohazard bag here. And if you notice, I keep everything zip-locked, just in case I run into some bad weather. You always got to be prepared. Not only for bad weather, but always keep your equipment sterile, because you're dealing with medical equipment. So you don't want to pull out anything that's going to be dirty or anything like that. So now I'm ready to open my bag. So I want to be able to get to my bag quick. So I'll pull that over just like that. The first thing I always grab for, you don't have to get this, a little pouch right here. It has regular EMT shears for cutting clothing. And I have another pair of shears for cutting bandages right there. The next thing, if I'm caught out there and there's no light, I have something very small right here. I don't have to carry a big flashlight, but I want a flashlight big enough and small enough that's actually going to give me some sufficient light in case I'm caught in the dark or anything like that. Tweezers or forceps right here to carry bandages, and something a little bit more pointier than that. I run into splinters or anything like that. I have that there. Of course, if you take the administration of oxygen course, I keep myself what we call a non-metallic wrench. And here's the pouch that it comes in right there. And so when you get ready, just take your time. Just throw that in there. Take that. I'm going to pop that in there. Throw those shears in there. Just like that.
Really, none of this equipment is very complicated, but it's the kind of things that you want to have that just make life easier when you have an emergency. The ability to cut things, to be able to probe things, these are very good and great to have.
And if you carry a Leatherman, you can just pop it right in there.
Leatherman is another great tool to have. Put it in my pocket.
So then the next thing I want to do, if you do take blood pressures, I'm going to pull my blood pressure cuff out here. And first thing in my cuff, I'm going to have a watch. Because if I'm taking pulses, I want to be able to feel the pulse with a second hand on it. And this watch also glows in the dark in case I'm caught out there like that. Then I'm going to have myself also in my bag, I'm going to carry what we call a pulse ox. With the pulse ox, it's just going to measure a person's oxygen level in their blood, give me their pulse, and it's also going to let me know if the pulse is regular, irregular. You turn it on by that button there. The battery's in. That's the battery I do.
But these things, you might see them, if you look for them, you might see them with prices of $500, $1,000. This is a little fingertip, probably cost you about $50. A little expensive, but not so expensive that you couldn't get one if you really want to be prepared. Especially if you got someone who has difficulty breathing, you've got an uncle or an aunt or a grandparent who's got COPD or something like that, and you want to be able to check their how well they're oxygenating.
here's my blood pressure cuff, and here's my stethoscope, and that's good to have. I get a Littman, I pay a little extra for my stethoscope. Just in case I have to listen for lung sounds, you want to make sure you have a good stethoscope.
And again, it's not so expensive that if something happens and you leave it behind, you'll cry for a little bit, but you won't be upset that you spent $200 on a stethoscope in the cost.
So with my stethoscope, if you notice, I'll put the cuff back in. There's a certain way I just take the cuff, the stethoscope there, I pop it in here, and I kind of want to keep everything together so that I know when I grab this pouch, everything's there, and I'm not reaching, where's my pulse ox, where's my watch. And this watch, basically if you're out there, you're going to wear it on your wrist. Take that, and I'll throw that back in there because I know that's in there. And the watch, I'll just keep it here. And this isn't a watch I wear every day. I keep it inside my cuff here so that I know when I reach for it, it's there.
And it's your famous Timex watch.
Right. And the first thing before you do anything, I'm going to reach for my gloves. These gloves are latex and they're powder free. People are allergic to latex and people are allergic to powder. So I want to make sure I have a sufficient amount of gloves.
Is it nitro gloves, John?
Nitro gloves. Right. So with my blood pressure cuff, what I wanted to say was sometimes people are very big. So I happen to know if someone's very, very big and my cuff is too small, I may get a false high. So in that case, I don't want to run into that. So I'm going to actually carry another cuff with me, which is a larger cuff than this cuff. So I carry 2 cuffs in my bag. Now, as far as water, I'll carry some sterile water. When you get to sterile water, liquids and things like that, always watch the expiration date. There's always going to be an expiration date on them, so you watch for that as well. Some people are on medications. I can't remember all the medications. I'm not a doctor. So I'll go ahead and carry what we call an EMS field guide. And basically that I use for the back. And in the back it has all medications, generic and brand names. And it tells me what that medication is for. The next thing I have in my bag is quick ice packs. Right here. They come in a little pouch like this. You may want to, if you take it out of here to save space in your bag, you can also throw that in a Ziploc bag, just to cover it. And they're small, they last about 5 minutes, but they're good to have. I normally carry 2 of them.
Yeah. They're better than nothing, but if you really have someone who's got a nasty sprain or injury, if you have access to ice and ice water and a baggie, you want to go for that first because the ice and the ice water will mold itself to the limb better than that will. It will last longer and it will stay colder for a longer period of time, as well as it doesn't get as cold as just plain ice all by itself. So ice and water and a baggie is a good thing to have.
So these type things here is what I use for vital signs, taking pulse, respirations, and blood pressure. Shock, treat for shock, keeping somebody warm. I can't carry a big blanket with me. So this is what we call a space blanket right here. It folds pretty good. It's aluminum. You see a lot of people, marathons.
They have them all the time. And you might think that these things don't work very well, but John can tell you he was up there in upstate New York, and he used one of these on a night where it was well below 0, and he was surprised by how warm he was.
Oh yeah, I was in Watertown, Fort Drum, New York, and it's very, very cold. That's where the United States military does cold weather training, so that blanket worked. I was sold on it after that night. The next thing is like musculoskeletal injuries when it comes to splinting. I know a lot of people use boards for splinting, but in this particular case, since it's just a small bag, I can't be throwing boards and everything. So I carry what I call a SAM splint in my bag, a SAM splint. This is a SAM splint right here. It's round, and when you open it, it actually comes out. And if you can see, it's pretty flexible. So I'll cut the SAM splint depending on how I need it. If I'm splitting the arm, the radius ulnar here, the foot, the ankles, that works for both of them.
SAM splint is a foam covered aluminum. You can mold it, you can cut it again, as John was saying, to any size or shape that you need to go. It's a little expensive again, but not so expensive that you can't have it. It's a real nice to have, especially if you're doing backpacking and wilderness first aid. This is an excellent tool.
The next thing we use is cravats. You may know cravats here. Basically, you see somebody in a sling. We call it sling and swap, so like shoulder injuries or fractures. We'll throw a cravat on there, and also for tying. If I use this, I have to have something to tie it with. I can tape it, but I'd rather use the cravat. So I carry plenty of cravats on me, at least 4 or 5, 6.
So that's a good for, as John was saying, for slinging, for swathing, for tying things up. It's an extra kind of bandage you can have if you don't have any roller gauze. These things work excellent for that also.
And if you ever get yourself caught in smoke or any type of hazmat type situation, it's better than nothing. Now you can take like a bat and wrap it around so I'm not inhaling anymore. So I'm not carrying, different type of masks. So also when it comes to fingers, I mean, you can use a popsicle stick, that works. A tongue depressor works. In my case, I have different size, it's a little advanced, but I'll throw that on there. I have them for the pinkies, I have them for every finger. A whole bunch of them there. And I'll just tape that thing up. They come in different sizes. Like I said, you can splint with, I can cut this, take this SAM split and cut what I need and just splint a finger. But this is just something out there that
it's one way. And again, if it's a finger, you can also do a body splint and tape two fingers together. Again, if you have nothing else, you can always do that.
If you're ever in a pinch and you don't have the tape, if I use my SAM splint, if I have to, I'll take the ace and I'll just use that. But as EMTs, we don't wrap. So, we don't wrap ankles and all of that.
So you want to be careful using these because they can get too tight. You want to be careful with how much compression you actually put in one of those.
Yeah, and so that we know when it comes to feeling for temperatures, I mean, if you want at home, you can get yourself a thermometer in order to take temperatures, but just so that there's paper ones out there. They're dot temps they call it. You throw the paper underneath the tongue, wait about a minute or two, and then you pull it out. It's easy to carry, and it doesn't take up a lot of space in your bag. Now when it comes to hemorrhage control, everybody's heard of 4x4s, 2x2s. The reason why they call them 4x4s is only because it's 4 inches by 4 inches, 2 inches